Thousands are raving about our best-selling 100-page scenario book, and so we started creating the expansion books to go along with it, including the cardiac arrest scenarios, we have the airway scenarios, pediatric scenarios, and the MCI scenarios. And you can get this entire bundle at the link in our bio. This is Master Medics. Master Medics is an online learning tool made specifically for EMT and paramedic students. We've had 10,000 students come through us to transfer this textbook knowledge into their minds. And it works because it's fun, it's visual, and it's engaging. And if you want to try it out for yourself, you can start a 3-day free trial right now at the link below. Thousands are raving about our best-selling 100-page scenario book, and so we started creating the expansion books to go along with it, including the cardiac arrest scenarios, we have the airway scenarios, pediatric scenarios, and the MCI scenarios. And you can get this entire bundle at the link in our bio. This is Master Medics. Master Medics is an online learning tool made specifically for EMT and paramedic students. We've had 10,000 students come through us to transfer this textbook knowledge into their minds. And it works because it's fun, it's visual, and it's engaging. And if you want to try it out for yourself, you can start a 3-day free trial right now at the link below.
All right, good evening, everyone. Hopefully you guys are excited to play some more games tonight. And just to make sure all of the live feeds are going, so let me just kind of reach around here and double check. There we go. There we go. Looks like everything is working. Can you guys hear me okay? I know that I'm not, I don't have my usual voice. I'm feeling a little bit under the weather, but we're going to push through and have some fun tonight, and then hopefully feel better in the morning. Okay, so we're going to be playing a game tonight that's going to be really kind of in resemblance of Who Wants to Be a Millionaire. That's kind of the idea with what we built, and the reason I built this, what we call Light Sirens and Riddles, is our new game that we're releasing, that we're going to be playing with you all on a regular basis, is all about multiple choice exam questions. Now, this one is to kind of get you guys in for the feel, get you guys an idea of how it's going to be. Some of the questions are really easy, some of them are more difficult, and then we're going to start to ramp it up as you guys get familiar. And we're going to be setting up an interactive system where you can text in your answers, and you can actually, we'll be doing polls, so that way we can see what everyone thinks on that particular question. That's something that we're going to be setting up at a later date. And for participants that are here, whether you're members or whether you're going to be watching on social media, you guys are the most people that are competing the most, that are participating the most, have the opportunity to win our brand new coins that we are just minted. These are custom coins, brand new, and we're shipping them out to participants of our games. So before we get started, I'm just going to make sure the live feed is running here, make sure everyone can hear me. So while I'm doing that, and while we're waiting for everyone to kind of pile in here, why don't you guys let me know, where are you all from? Go ahead, throw that in the comments. Where are you all from, and where are you all watching from here? I'd love to hear where you're at. Where are you all from? We're going to get to our first question right away here. Where are you all from? Queensburg, California, the Philippines, Lexington. I was just through Lexington 6 months ago. Washington, Alaska, never been. Eaton, Washington, Eatonville, Georgetown, Texas, Illinois. Right on. Let's see where you all from over here. Minot, North Dakota. I was there recently. Edmonton, Ohio. Midnight here in UK, so you're getting some late night games in right on. North Carolina, Australia. Awesome. It must be morning in Australia. Ghana. Very cool. Very cool. All right. So why don't we get into this? It's very simple. All I ask is that you guys participate as much as you'd like with these questions. It's okay if you get some wrong. That's the whole point, is that you are supposed to make mistakes in order to better yourself. All these questions are going to be multiple choice. You simply, in the comments, put A, B, C, or D. I'll give you a few seconds to put your answer in. I will verbalize every single question, so in case you can't quite see it, because some of the scenarios are a little long, which makes the text a little bit smaller. That's okay. I'll make sure I verbalize it. And then we will kind of have some fun, and we'll do some explanations and talk about why the answers are the answers if we need to. So let's get into our first one of the night. Nice and easy. Just to get us going. What is the primary function of the atrioventricular node in cardiac electrical conduction? What is the primary function of the atrioventricular node in cardiac electrical conduction? A, to pump blood. B, to slow down electrical impulses. To generate electrical impulses. And D, to oxygenate blood. What do you think? Go ahead. Throw your answer in the comments. I'm just going to walk around here, see what you guys got going on TikTok here. Lag, yeah, unfortunately it's going to be, hopefully it catches up for you all here. C to slow, or C, you guys are all thinking C. C. B. The answer to the question is B. Okay, so let's talk about this answer here. Okay, remember, we want to look at the main things that that we're seeing here. So the atrioventricular node. The atrioventricular node, where's my heart? There it is. The atrioventricular node is this node right here. Okay, it's this node right here that's right in the middle. And so that's not the main pacemaker of the heart. Okay, that's the SA node. So if this said SA node or sinoatrial node, I would have said that its primary purpose is to generate electrical impulses. That's its whole purpose. Okay, the AV node can generate electrical impulses. It can generate them. It's not its primary focus. Okay? It's not its primary focus. Its primary focus is to actually slow down electrical impulses. So when the SA node fires and it's sending electrical impulses through the atriums, the AV node actually harnesses that energy from the SA node, that electrical energy, for a split second to give the ventricles time to fill with blood. Okay, so the primary function of the atrioventricular node is actually to harness and slow down impulses before and give the chance, or give the ventricles time to fill with blood. So the answer to that question is B. All right. All right, I'll read out this question. Might be a little bit hard for you to see. You are a paramedic assisting with the delivery of a baby in a home setting. The baby is just being born and appears healthy. As a part of the newborn's assessment, you need to obtain an APGAR score. At what point after delivery should the practitioner obtain an APGAR score when you're assessing this baby? Okay, so is it A, immediately after the delivery, B, 1 minute and 5 minutes after delivery, C, 5 minutes and 10 minutes after delivery, or D, 10 minutes and 15 minutes after delivery? Go ahead. What do you think the answer is here? I see a lot of B's. Yeah. And I agree with you. I think that B is the best answer in this particular case. Okay, so we typically will do a APGAR score immediately after a delivery at the 1 minute and the 5 minute mark. So it is pretty soon after delivery. I said immediate. I probably shouldn't have because that's part of this answer. That's not correct because there's a specific time, and it's 1 minute and 5 minutes as opposed to immediately after delivery. We can do them at the 10 minute and 15 minute mark if we're seeing, if you look at a score sheet that they use in a hospital, they do APGAR scores for laters. When you have poor APGAR scores in the first 1 and 5 minutes, they will continue to do APGARs for 10, 15 minutes afterwards. But for our purposes in EMS, best answer in this case is B. You might recognize that music. All right. I'll read it out again for you. You respond to a call for a 58-year-old male patient experiencing severe shortness of breath. Upon arrival, you note that the patient is sitting upright, leaning forward, and using accessory muscles to breathe. He is diaphoretic and appears anxious. He has a history of chronic obstructive pulmonary disease and tells you he's been feeling increasingly breathless over the past 2 days. His oxygen saturation is 88% on room air, and can hear wheezing on auscultation. Based on the initial assessment, what is the most appropriate initial treatment for this patient? A, administer oxygen via nasal cannula. B, initiate CPAP with low pressure settings. C, provide nebulized bronchodilators immediately. Or D, perform endotracheal intubation. What do you think? What do you think? B, C. Remember, I'm basing this off, you're doing this in an exam. Okay? Maybe not what you would do in real life, but what would you do in an exam? Hold on, TikTok. We're having some technical stuff. Hopefully that helps. All right, let's see. A, you're thinking A. Okay. So, you guys are kind of split between A, B, and C. You definitely know you're not intubating this guy right now. That's good. Okay. Best answer in this particular case, okay, what is the most appropriate initial treatment for this patient? It is C. Okay. Okay, it is C. So, why is it C? Okay, let's break this down because I know you guys, a lot of you picked A and you're probably wondering why the heck is it not A? The reason it is not A is because of the detail in the answer. Administer oxygen via nasal cannula for 1 liter per minute. Does that sound correct for a patient that has a room air of 88%? What do you think? Does that sound right? You got a person that is 88%, and you're going to put 1 liter of oxygen on them? No, that doesn't make sense, right? That's not correct. So, A, if it said administer oxygen non-rebreather at 15 liters, I would probably lean towards that one as my initial first step before anything else. But because I'm only administering 1 liter per minute through a nasal cannula, that's not appropriate for this particular patient. Okay, so A's out. Okay, B, initiate CPAP with low pressure settings. I think that we probably would CPAP this patient. I believe that we would. From a testing purpose, would it come before nebulized bronchodilators? No. Okay, testing purposes, it's looking for your identifying how to do this in a testing or in a scenario. And in a scenario, from a testing purposes, it's linear, it's in line, okay? It's not like you can do two things at the same time in testing scenario purposes. There's no delegation in it. So think of it in this way, is that what would you do first? And in a scenario, if you were to choose between 1, 2, or 3, from a scenario purposes, they expect you to go with a bronchodilator prior to CPAP, making C the best answer in this case. You guys see how I went there? Does that make sense? It was a tricky question. But if you guys are doing licensing exams, a lot of questions are tricky. And you have to look at them in detail. So this is a good little reminder for you all that have to take a licensing exam. Your licensing exam is not designed to trick you. Okay, it's not designed to trick you. It is designed to make sure that you look at all the details. That is the key. Okay, you need to critically think. It's trying to see if you can critically think through a question. And this is exactly what I mean by that. Okay, so it's not there to trick you. It has all the information that you need in order to get the right answer. The key is that you need to look at the details like this. Okay, which brings me to my segment is that we actually have an exam prep at Master Medics. And so if you're preparing for your licensing exam, you're in school and you're struggling and you want to understand medicine a little bit more, we are the masters at that. There's no one that does it better than us. Okay, we have helped 30,000 paramedic and EMT students all over the world. Schools use us. Schools are coming to us to implement us in their learning management system so that way their students can use Master Medics while they're in their education and while they're at university and college. Those are the things that we are experts in. And so if you want to have a part of that, you can check us out for a 3-day free trial on our website, mastermedics.com, and you can check it out for free. If you love it, you can stay as long as you like. It's not for you, you can cancel anytime, no hard feelings at all. You can still enjoy the lives. But thought I'd plug that in there, that if you are interested and you're curious about what we do and the things that we do, that is the best place to check us out. Okay, let's move on. Okay, here's another scenario question for you. You're responding to a call for a 68-year-old male with sudden onset of weakness. Upon arrival, you know that the patient has right-sided facial droop, slurred speech, and right arm weakness. The patient's wife states that these symptoms started about 5 minutes ago while they were having breakfast. Based on the patient's presentation, you suspect a stroke. What is the appropriate next step into managing this patient? A, obtain a BGL to rule out hypoglycemia. B, perform a 12-lead ECG to rule out myocardial infarction. C, initiate transport to stroke center and pre-notify of en route of a positive stroke. And D, provide supplemental oxygen and reassess in 15 minutes. Now, if you were on our social media channels the last couple of weeks, you might have seen this question. And there was a pretty hotly contested debate until we put our explanation in. And then it started to make complete sense. So remember, you're answering this question based on what is your linear next step, not I would do all of them in the back of the ambulance while I'm multitasking 5 different things. It's not what I'm saying here, okay? You are on your own in the scenario land. What do you do first? Okay, what is the best answer in that regard? You think B? A? What are y'all thinking? See if I can move you a little bit closer here, Instagram. That might be a little easier to see. Hold tight. Maybe that helped. You're about 10 inches closer now, but I don't know if that helped. Okay, what are you thinking? You guys seem a little bit less confident now. Okay, answer A. Hey, Kenna. Good to see a bunch of our members back as well. This is fantastic. Okay. So let's look at this question again and break it down. Okay, so we're suspecting a stroke. Can we say that this is for sure a stroke based on just this? Probably not. Okay, is there a really, really good chance of stroke? Yes. But there's about 5 different things that can show stroke-like symptoms. So regardless of the likelihood that it is not a stroke, we still need to confirm, okay? Especially if we're going to notify a center of a positive stroke. We don't know that right now, okay? Because we haven't ruled out one of the number 1 reasons that we see stroke-like symptoms, which is hypoglycemia. So if you're going to do this patient, what's the next appropriate step in this particular case? D doesn't make sense because why would we reassess in 15 minutes? It seems like a waste of time. B, I see why you would do an ECG at some point, but I don't think that it is the priority at this particular moment. A is the only one that really makes a lot of sense in this case because we need to rule out hypoglycemia, a known stroke-like symptom condition, before we can notify someone of a positive stroke. So in a scenario setting of what we would do first is A. Time might be tissue. You're right. Time might be tissue. How long does a BGL take? 10 seconds? Okay, this is the priority answer. All right. Ready? Don't worry if you get these questions wrong. I'm here to teach you and how to break through these questions. Some of the hardest ones were in the beginning, so we're through those. Okay, so B, it's okay to be wrong. There's nothing wrong with that at all. I'm here to show you and to teach you so that way you don't need to make these mistakes on your licensing exam where it actually counts. This is supposed to be fun, so let's have some fun. All right, you arrive on scene to find a 28-year-old male unconscious with shallow breathing and pinpoint pupils. A friend reports that he may have taken heroin. What is the best immediate treatment for this patient? A, BVM ventilation. B, administration of naloxone. C, intravenous fluids. And D, oral activated charcoal. What do you think? Bo thinks A. Dave thinks A. Willie thinks B. I'm guaranteed it's going to be full of A's and B's. A's, B's. Okay. Best answer for this one here. Uh-oh. What'd I do? Oh, there we go. There it is. I did some weird animation stuff wrong. Okay, best answer, BVM ventilation. Now, in a scenario land, okay, which is exam prep land, okay, examination land, ABCs come before naloxone. I think we can all agree on that. ABCs come before naloxone. Yes, is naloxone going to help your ventilation? Sure. But in scenario land, ABCs, ventilation comes before administration of medications in scenario land, meaning BVM ventilation is the priority in an exam prep world. Okay? Okay, which condition is characterized by the heart's inability to pump blood effectively? A, hypertensive emergencies. B, cardiogenic shock. C, heart failure. Ooh. D, acute coronary syndrome. I know what two are going to be the top ones. Let's see what you guys think. I don't know if I have a great answer for this one. I think that I probably could have chosen better answers. Or better options. Because there's two there that kind of lie on top of each other. So I'm not convinced that this is a fair question, but we'll talk about when that happens. This is a good opportunity for that. Okay, I put B as cardiogenic shock. I don't think this is a very good question. I don't think the options are very good because I think that I could convince 50% of you that C is the answer. Oops, let's go back. No, we're not done yet. Okay, I think that C is a pretty good answer as well. Okay, so this happens sometimes. So you'll notice that your score in your exam, there's about 10 questions that you get in your exam that are not weighted, meaning that they do not count towards your full mark because those questions are being tested. They're trying to determine if it's a fair and a consistent question of students getting it 80% of the right 80% of the time. Okay, so when a question such as this goes out there and they get a question that only get that right 50% of the time, or even 30% of the time, it probably indicates that the question is not clear or the options are not clear. And that's what's happened here, is that I think that this one is leaning towards both B and C. So I don't fault you at all for choosing C, but this does happen. This is totally unplanned. I didn't mean to do this. I just realized that I screwed this up. But it was a great little segue into how we test questions. And so if you get a question that you're like, this is crap, I don't really understand what's going on, there's two really good answers that don't really have a clear answer, there's a chance that question's being tested and it's not going to be weighted either. And so my advice to you in those situations when you're getting angry and frustrated with an exam is to just let it go. Okay, let it go. Let that question go. It doesn't matter. Okay, because there's a chance it doesn't at all. A chance that it doesn't even weigh against what you're doing. Okay, and so to let yourself get rattled over a question that they're just trying to test to see if it's a legitimate question is just going to screw you over for the rest of the exam. Okay, so questions like this, don't let them rattle you. Okay. All right. Okay, what is the most likely sudden cause of a sudden drop in blood pressure in an anaphylactic reaction? A, vasodilation, B, bradycardia, C, hypoxia, and D, hyperventilation. What is the most likely reason in anaphylaxis that we see a drop in blood pressure? What do you think? What do you think? Most of you guys are thinking what I'm thinking. I agree. Vasodilation is the number one reason that we see hypotension in a patient with anaphylaxis. The reason being is that when mast cells are systematically activated, those are your immune cells that have a reactionary drive, that when you have stimulation of mast cells, it causes vessel dilation and shifting of fluids from inside the vessels to outside the vessels. So that's a reason that anaphylaxis in itself is a form of distributive shock, just like sepsis is, because of that immune reaction. And so vasodilation absolutely is the correct answer here. Okay. Primary mechanism of action for ACE inhibitors in cardiac emergencies is to what? Increase blood pressure, increase glucose levels, decrease blood pressure, increase heart rate, decrease cholesterol levels. Thinking B, C, what do you think? Okay, best answer for this one, B. ACE inhibitors, for those of you who don't know, are angiotensin-converting enzyme inhibitors. So there's a reaction between angiotensin 1, which is created within the body. Once it reaches the lungs, which is abundant with angiotensin-converting enzymes, it binds with angiotensin 1 to create angiotensin 2. And angiotensin 2 causes significant vasoconstriction. Okay, and so by blocking angiotensin converting enzymes, it doesn't allow angiotensin 1 to turn into angiotensin 2. So that means that we have a reduction in blood pressure. So best answer is it decreases blood pressure. That's the goal of it. All right. We're getting somewhere. What the heck? There it is. Okay. Here's another pharmacology question. What is the main physiological effect of beta blockers? A, increase heart rate. B, decrease heart rate. C, vasodilation. D, bronchodilation. Interesting. What do you think? Main physiological effect of beta blockers. Lone Wanderer's thinking B. What are you thinking over there? What are you thinking? B, 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 D. Beta blockers predominantly target the beta 1 cells, which are decreasing heart rate. Beta 1 does the heart, so it decreases the heart rate. Beta 2, beta blockers, they would cause, constriction. Okay, so that's why we use things like beta agonists, the things that actually stimulate the beta cells. They actually cause bronchodilation. So beta stimulus would cause D. Beta 2 stimulus would cause D, so like salbutamol, albuterol. But beta blockers themselves are predominantly selective beta blockers, which are beta 1s. All right. Okay, what is the first line treatment for ventricular fibrillation? First line treatment for ventricular fibrillation. A, CPR only. B, defibrillation. C, administration of epinephrine. Or D, administration of amiodarone. What are you thinking? What do y'all think? Best answer, defibrillation. Now, why is that? Okay, let's break this down. A is the only one that really is the only one that I'm assuming that people were kind of confused about. The key to this is the only part. Okay, CPR only kind of just rules everything else. So we're just doing CPR and nothing else. That's what that option is saying, which is not really correct. Okay, if it just said CPR and left the only part out, okay, and it was just CPR, then I would say that A is probably your best answer. But because it says CPR only, saying that that's all we're doing is basically CPR without any ventilation, without any defibrillation, without anything else, it's not as correct. And so best answer in this case, defibrillation. more left. Okay, nitrates, like nitroglycerin, are used in cardiac emergencies primarily because they decrease myocardial oxygen demand by dilating veins, increase blood pressure, decrease the heart rate, or they're primarily used for pain control. This one should be a pretty good one, pretty given. Absolutely. It causes a decrease in myocardial oxygen demand by dilating the veins. Okay. Nitroglycerin primarily is a venodilator, causing venodilation, which reduces preload, which ultimately is going to have a pressure reduction, thus reducing afterload, particularly in the lungs. So nitroglycerin has a more potent impact on patients that have left ventricular issues as opposed to right ventricular issues. There's a big debate about should we be using nitro in both. Sure, we could go there at some point. We have gone there a few times. But the whole purpose is to cause venodilation to decrease myocardial oxygen demand. That's its primary use. All right. In the context of non-pharmacological interventions, how does positioning a cardiac patient affect their condition? Interesting. Okay. A, lying flat increases cardiac workload. B, sitting up can decrease cardiac workload and improve breathing. C, standing increases venous return. D, inversion therapy is recommended to improve circulation. That's interesting. Best answer. The most correct answer. Okay. B, sitting up can decrease cardiac workload and improve breathing. Improved breathing is kind of the best part there. Okay. All right, two more. How does CPAP therapy benefit patients with congestive heart failure? A, by reducing the need for oxygen. B, by increasing the heart rate. C, by decreasing intrapulmonary shunting and improving oxygenation. D, by decreasing blood glucose levels. Pardon me, sorry. What do you think? Most of you are thinking C. I agree with you. Okay, CPAP is going to decrease intrapulmonary shunting and improve oxygenation for two reasons. One, it's going to put pressure on the superior inferior vena cavas, and it's going to reduce preload, which ultimately reduces our pressures that are going to be having a big pressure battle inside the lungs. So that's the first thing that CPAP is going to do. The second thing that it's going to do is that it's going to introduce more PEEP and pressure into the alveoli, recruiting more alveoli, meaning that there is more distribution of fluid within the lungs to all those alveoli that are now recruited. So it effectively improves oxygenation by introducing more alveoli pressure. And second, causes better pulmonary shunting by introducing those alveoli, meaning that more fluid can move to those alveoli, reducing pressure issues. All right, last question. Okay, which of the following is not a component of a trauma triad of death? A, hypothermia. B, hypokalemia. C, acidosis. And D, coagulopathy. What is not part of the triad of death? What do y'all think? I'm glad you guys all, for the most part, have heard of the triad of death and trauma. And the answer to this is hypokalemia is not part of the triad of death. If this said hypocalcemia, then we'd have a little bit of a conundrum, because now we're starting to see the triad, or the diamond of death. That the diamond of death is effectively something that's kind of been indoctrinated, because about 50% of trauma patients are hypocalcemic. And so that is now being introduced as a major indicator or major factor in clotting, is being hypocalcemic. But in this particular case, the answer that is not part of the triad of death is hypokalemia. The rest of these three absolutely are. And then hypocalcemia is a new introduction to the diamond of death, which is a new thing that is probably about 2 years old now, maybe a little bit more, that has been introduced because of the prevalence of hypocalcemia in trauma patients, and specifically hemorrhagic shock patients. All right. So we made ourselves millionaires. Congratulations. Thank you for playing with me tonight. Hopefully you guys had some fun and you learned a few things along the way. This is just a test one to kind of see how it goes, see if it was, visible, you guys enjoyed playing with it. And then next time we play this game, which will probably be in a couple weeks, will be one that you can interact. And so there will be a QR code that you can snap a picture of, and then you can actually go to a website or text in your answers, and it'll go to a poll. Your name won't be there, but it'll go to a poll, so that way we can see what everyone's thinking, as far as, 50% of the people think this, 80% of the people think this, before we show the answer. It gives it a nice interactive kind of part to it, which I think will be a lot of fun. So hopefully you guys enjoyed it. We are looking for feedback on this. So if you do have feedback, please feel free to put it in the chat and put it in the comments of the videos. We would love to hear your feedback on playing games, and if it's enjoyable, first off, and second, if it's helping you learn and prepare for things. That's really important to us. So hopefully you guys enjoyed it. Thanks again. Please leave your feedback. We'd love to hear about it. And we will talk to you next time on Friday. We'll be doing a case study. And the next Wednesday, we will absolutely be playing another game with you. We're playing games every single Wednesday. We're mixing it up about between 3 or 4 games to make things interesting for you all. All right. Thanks again. And we'll talk to you next time. You know what? I forgot. Hopefully they're still here. Coins. I'm going to pick someone here. Let's go with Crystal B on our live stream with members. Crystal B. Okay, Crystal B, you win a coin. Okay, so go ahead, shoot us an email, and I just need your address so that way I can ship you a coin. So you've won one, Crystal B, as one of our members. Geoff at mastermedics.com, and let's go with Willie Mead on Facebook. Shoot us a message, get us your address, and we're going to ship you a coin. Okay, congratulations to our big participants. I really appreciate it. And Crystal and Willie, you guys get coins. Make sure you send us a message or email, preferably, so that way I can kind of collect everyone. I still have more to send out from last week, and we're going to get you some coins. So congratulations. We're going to be giving out coins every single week on game night to our members, as well as to the audience that is contributing as well to it. So thanks again, and we will talk to you next time.